good day everyone. My name is Trishanji Martinico from BSN2D, and today I will be discussing about the preparation of medication from a vial. So the first procedure is to wash your hands with soap and water or sanitize it, or to perform hand hygiene. It is to prevent spreading of the microorganisms. The next is to organize the equipment to save time and energy. Check the label of medication vial with the medication record or electronic medication record using 5 rights of drug administration. It is for the safety of the patient. Perform dosage calculations if vial contains more medication than client requires. We should know that the patient would be tolerable in the condition or in his body. Next is to remove thin seal cap from the top of vial without touching rubber stopper. We are not letting it to be contaminated. So next is to firmly wipe rubber stopper on the top of the vial with alcohol swab. So we must clean first the rubber stopper to prevent any spread of the bacteria. Read the instruction at vial label as to the amount of diluent you are going to use. So tell your client what is or how much amount of medication will the client be taking or administered to make the client aware. Then dilute or reconstitute the powder during the vial. The next is to pull end of plunger back to the filled syringe with a volume of air equal to the amount of solution to be drawn up. Do not touch inside of the plunger. It is for accurate outcomes of the procedure. Next is to remove needle cap and needle if necessary. It is to prevent contaminating the rubber seal. Next is using a slightly slanted angle. Firmly insert needle into the center of rubber top of vial with the sharpest point of the needle, or the tip of the bevel will be entering first. It is to minimize the pain, or to insert the needle and for the less pain. Continue insertion until the needle is securely in vial yet above the level of the fluid. So the rationale for this is making sure that the needle is indeed securely in the vial. Next is the press end of plunger of down to instill air to the vial to prevent the build-up of negative results of vial. So the next is to hold the vial with the non-dominant hand and then turn it up, keeping the needle or spike inserted. Control the syringe with the dominant hand and keep the plunger down with thumb. Position of needle allows medication to be expelled without down needle. Next is to pull the needle or spike back to the point at which bevel is beneath fluid level. Keep needle or spike beneath fluid as long as the fluid is being withdrawn. So it prevents aspiration of air bubbles. Then, slowly pull end of the plunger back until appropriate amount of solution is aspirated into the syringe, pulling the plunger rather than the barrel, resulting in loss of the medication. If air bubbles enter the syringe, gently flick syringe barrel with fingers of dominant hand, and then keep a finger on the end of the plunger. Continue holding the vial with the non-dominant hand. The air may force fluid out ampule and medication will be lost. Push plunger in until air is out of the syringe. No air must be in the plunger. Withdraw additional solution if needed. So, if it is excess, the withdraw. Pull the needle out of the bottle while keeping a finger on end of the plunger. Apply sterile needle on the syringe if IM or SQ or ID injections will be given. To apply sterility to syringe if any IM or ID injections will be given. The next is, if bubble remains in the syringe, hold the syringe vertically with the needle pointing up if attached. Pull back slightly on plunger and flick syringe with fingers. Slowly push plunger up to release the air, but not to the point that expelling the solution. For accurate outcomes of the procedure. Then is to recheck amount of the solution in the syringe comparing with drug volume is required for accurate result of the drug dosage. Next is to compare the drug label with medication record or electronic record. The rationale for this is to make sure to avoid any errors. Next is to change the needle. If used to withdraw the solution from a vial and drug is known to be irritating to the tissue, replace the cap. The rationale for this is remove or replacing contaminated needles to avoid the spread of the contaminations. Label syringe with drug name and amount of drug. It is to know your client and the drug. So next is to place the syringe, medication record, and additional alcohol swabs on the medication tray. It is for the next use that saves the time. And then discards and restore all the equipment appropriately. Discard the equipments that are being used and restore the equipments that have not been used. So in order for us to be ready for the next use and to avoid the spread of the contamination. Next is to perform hand hygiene to prevent the transmissions of the microorganisms. So when talking about the attitude of the nurse should accept constructive suggestions or criticisms and opens to all suggestions and criticisms from errors. And then the nurse should assume responsibility from his or her actions for the improvement or betterment of oneself. And that would be all. Thank you.